Thank you for joining us today. This is a question and answer session for March 5th. Public Health Director Annette Rodriguez and Dr. Chris Bird are addressing questions received this week. Please feel free to add your follow-up questions to chat. The coronavirus has been in Texas for a year now. The statewide mask mandate will be lifted on Wednesday after 8 months of being in effect. And Texas will be 100% open. The Johnson & Johnson vaccine was approved by the FDA under emergency use authorization. And teachers are now included in phase 1B in Texas and eligible for vaccines. Today we're going to be talking about teachers, Johnson & Johnson vaccine, and masks. Dr. Bird.
All right, thanks everybody for joining in. We have some pressing questions for our Public Health Director, Annette Rodriguez. So the first question that we have is, will vaccine clinics be able to work around teachers' schedules?
Well, you know, we're doing the best that we can. So we got first doses yesterday. They were supposed to come in next week, so we got them early. So we did schedule a vaccination clinic, if you will, around teachers, because they've been reaching out to us saying, if you could only have it on a weekend. And we always say, well, we normally get vaccine on Monday, so we put it in people's arms on Tuesday. And so since we got it yesterday, we are going to have a vaccination clinic tomorrow, which is Saturday, just as they requested. So I hope to see 2,000 teachers, school professionals, and daycare professionals there at the clinic. It's going to be at West Oso High School. And we're registering people today. They can call 561-1101 to get registered today so that they can get their vaccine tomorrow before spring break. Now, I will tell you, some of the teachers asked us, can we get the vaccine after spring break? So, you know, we're not catering to a lot of people. We really are trying to put vaccines in arms of the masses. And so we really are hoping that people are being very picky about when and where. But as soon as we can get vaccination clinics moving, we are doing that to vaccinate as many people as possible.
Right, thank you. Sounds good. The next question is about Johnson & Johnson. When will the Johnson & Johnson vaccine be available in Corpus Christi?
So we're hearing, and I don't know, I haven't verified this, but we're hearing that HEB, they have allocations from the feds as well as allocations from the state. And so we're hearing that they received some Johnson & Johnson. I have tried to verify it, but I haven't been able to talk to anybody yet. And they're going to have a clinic tomorrow at American Bank Center, and they have 1,100 doses of Johnson & Johnson is what I'm hearing. So it's one and you're done. That's the motto for Johnson & Johnson, one and you're done. I love it. So I hope that it's true, and I hope that we receive some as well next week.
All right, thank you. I don't understand the next question, so I'm going to skip it. Tiffany, can you make sure that it's written correctly? I'm going to go on to the one after that. When will you stop wearing masks, or when can we all stop wearing masks?
You know, I think when the threat is gone, and that's not yet. You know, so I know the governor basically rescinded his order that everybody had to wear a mask, and that's effective March the 10th, next week. And so what we're telling people is, while he did do that, that doesn't mean that you can't wear a mask. So take self-responsibility, protect yourself, protect those, your loved ones around you by wearing your mask. Continue to wear your mask until we're into a safe zone. You know, the state of Texas is a huge state. So there's probably places that don't have any COVID cases. And for those areas, they're probably safe not to wear a mask. But that's not our area. Our area continues to see cases in the double digits currently. We're also seeing cases that are going up. And Dr. Bird, you know, you look at these statistics every day, you know, you can add to this. And so while people think the statistics are going down, we're seeing that across, you know, the nation, the statistics are showing that COVID cases are rising.
Yeah, they're rising in the coastal bend also. Last Friday, it was just like a day or two. But now there's been a consistent increase since last week in the coastal bend. So there is an increase, and it has, you know, no connection to the governor's order. It was occurring before that. I think that it's important for everybody to realize that we want to wear masks until everybody who has a chance of being hospitalized or dying from COVID has the opportunity to get a vaccine. And the reason why is, one, there's a point when your personal rights infringe upon other people's personal rights. And so the reason why we're all wearing masks is to protect each other. And no one person's right now is outweighing everybody else's rights. It's the same reason why you wear seat belts. It's so that everybody else doesn't have to pay for your medical bills if you get in an accident. Eventually, once everybody that's had that chance and is really at high risk, even maybe a little bit more, because there's plenty of people that end up in the hospital that weren't high risk in the first place, then we can start thinking about taking off our masks. It's also important that the amount of COVID that's out there in the community, the amount of positive cases, become much lower than even what we're seeing right now. We're desensitized at this point to how much COVID is out there, and you don't want to take your masks while we're still in the middle of a large amount of COVID being out there, and then you have a high chance of contracting it. And lastly, for myself, when I run the model and I eliminate everything that we're doing to control COVID, except for vaccines, and assuming that people who have been infected are immune, which is an optimistic outlook, right now I'm still seeing a huge spike that could occur that would be bigger than the June 2020, July 2020 peak if we try to go back to normal. There haven't been enough vaccinations yet to be able to stop a peak like that from happening, and there's still enough people out there that haven't been vaccinated that are susceptible to hospitalizations and fatality that we don't want to let it rip right now. So that's my answer to that. And it's not just a hollow, everybody should wear their masks. We're looking at the available data that's there for us to look at and seeing that no, it's not the right time to do that. Now, an order at the state level is different than something that's decided for public health interests. And the governor still strongly encourages everybody to wear their masks and social distance if you read that order. It's just there's not going to be any fines or penalties if you don't wear your mask anymore. Okay, I guess I had a lot to say on that. Okay, next question. Did you wear a mask more after the statewide mandate, or was there no change in your mask wearing habits after the statewide mask mandate started in July?
For me, I started wearing the mask as soon as CDC said that we could. I would have worn it earlier, but because I always question why shouldn't we be wearing a mask? This is a respiratory illness. But CDC made sense to me when they said you shouldn't be wearing a mask right now, because if you do, you're going to deplete all of the PPE that's needed for the hospitals. And they're sitting at the bedside with the COVID patients. So that made sense to me, so I didn't wear a mask. So anyway, but as soon as they said, yes, let's go ahead and wear masks, and maybe you should make your own mask, I started wearing it immediately, and I really haven't taken it off yet. So there's nobody here around me. I'm in this huge show barn, so that's why I don't have a mask on.
Yeah, I don't know if everybody remembers when this task force started, but I read in the newspaper that I was one of the first people to wear a mask publicly that was talking about this. So I was obviously wearing a mask before there was any order. But here's what I will say. In analyzing the data, there's a strong correlation in the trend in COVID cases with the statewide orders that are being made. And every time there was a major ratcheting up of a statewide order, there was a slightly delayed reaction, but then a downturn in the amount of cases. And then the same thing with lessening of these statewide orders. When they've been lessened, there's maybe about a 2-week delay before we start to see a rise in cases. So even if the public health director and myself were wearing masks the whole time and it's not changing our mask wearing habits, other people in Texas are influenced by these orders, and it definitely affects people's behaviors. And I just want everybody to know that, at least from our perspective here, looking at the data locally, nothing has changed from last week to next week that would indicate that you should change the things that you're doing to lessen COVID. Now, if you're running a business and you were good enough to be limiting the amount of people in your restaurant or in your business, you can go back to 100%. I know from going around Corpus Christi that plenty of businesses are just open at 100% in the first place. Like Lowe's and Home Depot weren't limiting who could go into the store after the ice apocalypse for us to get our plumbing supplies, which is what I was mainly going out for. So that's probably one of the major changes. Now, importantly, if you wear your mask, and if you're a business owner, if you have your customers wearing masks when you're 100% open, that will help keep you 100% open. It'll help stop the spread of COVID. The masks go hand in hand with 100% Texas open. Okay, let's see. How about Jason and Tiffany? Are your mask wearing habits going to change?
Absolutely not. I'm not walking into HEB without a mask on.
Yeah, I'm still not walking into HEB. I did have to go into the hardware store to fix the plumbing because the curbside broke down, but I didn't have to go into HEB, and we're still doing curbside there.
Yeah, I'll still be wearing a mask.
All right. So let's see, Tiffany, that question that I skipped, is it written correctly?
Well, if everyone's choosing whether or not to wear a mask, how protected am I if I wear mine and no one else does?
Okay. I understand now. Annette, you want to take that?
Well, and that's a great question. So you would be a lot more protected if they were wearing a mask and you were wearing a mask. So the problem with only one side wearing a mask is the other side may be the one that's actually infectious, and they may actually be sneezing on you. And so if it gets into your mucous membranes, or if your mask, heaven forbid, and starts dripping, and it starts drooping below your nose, then you could easily pick up the respiratory infection. And so, again, it really is both sides, because you don't know who has it and who doesn't, who's been vaccinated, who hasn't, who's been vaccinated twice. Has it been more than 2 weeks since they were vaccinated with their second dose? So they built up the whole immunity and are at the 95% protection. You also still have the 5%, that you're not protected. And so you still could pick up the virus, but hopefully you would pick it up and it would be a minor onset of illness, and it wouldn't be as severe and you wouldn't end up in the hospital. But there's a lot of variables that go into that question. So you do, I think you should even have the right to remind somebody. We remind them here every day just coming through the show. They're in their car.
It looks like we're having some technical difficulties with Annette's sound stream. Annette, are you there?
Oh, sorry. Yes, I'm here.
Okay, can you repeat the last 30 seconds? 20 seconds?
Yes, it's really...
you know what? We're still having an issue in that.
Because you're not as protected.
Okay. Yeah. So for every person in a store that has COVID that's not wearing a mask, that's increasing the amount of virus that's in the air by that much. So 2 people without masks with COVID, that's increasing by 2 times, etc. So you're still protected by wearing a mask, but not as much as if everybody wears a mask, and it can be quite a large difference. And I apologize for this technical difficulty with Public Health Director. It looks like her signal's dropping out. So Tiffany, did we address your question?
You're muted, Tiffany.
Oh, is that what's happening? Technical breakdown.
We're going to work through all the technical problems.
Technical breakdown. I want everybody to know we have no AV support crew. It's just everybody you see right here is the whole show. There's nobody behind the scenes. So
Thanks for answering my question.
So we do the best we can. See, I'm going to move forward assuming that Annette maybe won't have a solid connection here. Hey Annette, are you back? Maybe.
Yes, I think I'm back.
Okay.
Can you hear me?
Yes, I think we addressed the question. So
Thank you.
something that we've talked about is trying to stay in shape during COVID, and so in the past week, I'll go first this time because I'm proud. I lost another couple pounds since last week. I had to dig more under my house. I think that really helped. But I'm probably not eating as much either, just because of all the little odd jobs I'm trying to, still recover from that ice apocalypse. And I started riding my bike again this week, so maybe things are going back to normal. How about you, Annette?
Well, I did say I'm here at the Richard Borchard Fairgrounds, and they serve us these turtle, beautiful looking brownies. So it makes it very difficult. But no, I haven't lost all that weight. Maybe I need to start digging under your house too. So if you need help, call me. So I need to do something. I'm doing squats. I'm doing lunges. I'm moving more. I'm not even getting on the scale. But then again, these kinds of things. I kept very well when we're out here vaccinating all day. So I don't know if I said, but our goal today is 7. We have a much bigger goal today.
What was that goal?
7,000.
7,000. All right.
7,000 today.
Look out, Los Angeles. We're on
Look
your
out,
heels.
Dodger Stadium.
Yep.
We're on our way. We would have done more than that. We would have done 9, except we saved 2,000 for the teachers for tomorrow. So otherwise, I would have knocked out 9,000 today.
Okay, so I think that's all the questions that we have that were pre-planned. Do we have questions from the audience?
Yes.
All
We
right.
have this question from the audience. Does the vaccine reduce severe disease or hospitalizations for people with pre-existing conditions, such as lung disease?
It absolutely does. And so the vaccines are very good. That is really what they are targeted at. It's reducing the severity of the illness. And so any of these vaccines, whether it's Pfizer or Moderna or Johnson & Johnson, all do that. And so that's why we're really hoping that there won't be vaccine hesitancy and people will get vaccinated so they can have that protection.
Yep, and this is one of the reasons why vaccinations are one of the key components of determining when we'll be able to take off our masks, because they are protecting people from going to the hospital and from dying.
Thanks for vaccinating so many people.
You're welcome. Send us over more and we'll vaccinate more people.
Yeah, a lot of my colleagues are asking if they can come down here and get vaccinated, because in their state it's very difficult. But it seems that here locally you're doing a great job in that.
Well, thank you. I appreciate that. So we're having a lot of teachers asking from different parts of Texas if they can come get vaccinated. And I tell them, come on down.
Okay, so any other questions, Tiffany?
I actually have one. Annette, It's my understanding that the teachers that are being vaccinated are the elementary, secondary, but it's not like university teachers yet. Is that accurate?
That is accurate. It's according to the governor's order, but we're not turning anybody away. Just so you know. So if they're a teacher, we're taking them and we're vaccinating. Again, like I tell people, if it doesn't make any sense to me, I'm going to do what makes sense. And if you're a teacher, whether you're teaching at a university level or you're teaching at a high school, you still have the same exposure. And so, yes, we'll take care of you and we'll get you vaccinated.
Great. Thank you.
You're welcome.
Okay. Well, I'd like to thank everyone for watching, especially if you submitted a question. In this Q&A, there's no A without the Q, and that's thanks to you. Next task force report will be uploaded this afternoon to social media. Please join us every Friday at noon for the question and answer session. And please remember to direct questions or comments to @CBCovid on social media. Have a wonderful and safe weekend.
All right. Thanks, everybody.
Thank you.